Well, Christina, they are talking about misdiagnosis, which could mean got the wrong diagnosis, or it could mean more of a missed diagnosis, meaning that they didn't get a diagnosis at all of what was really problematic for the patient. What they found were some pretty big numbers, as you mentioned. When it talked about people dying annually, it was about 371,000 people every year, and of people who had some sort of disability as a result of these missed or misdiagnoses, 424,000 people. That was what this study showed. Now, I do want to be clear that overall, going to the hospital, going to the clinic, the average person, there's less than a 0.1% chance of having some severe problem as a result of misdiagnosis. But there were certain areas where you had the biggest concerns. Things like stroke, those could be missed, leading to severe outcomes. Sepsis, pneumonia, a blood clot in a vein, which could lead to something like a pulmonary embolism, for example, and lung cancer. That's what they found were the biggest concerns overall with this. Now, what exactly is going on here? Why do these misdiagnoses happen? There are several different reasons, but let me give you a couple of examples. When it comes to stroke, people often know if you're having weakness, if you're having trouble speaking, things like that, that's a sort of indication someone might be having a stroke. But what about more vague symptoms such as dizziness and headache and fatigue? That could also be problematic for a stroke or some indication of a stroke. Or when it came to cardiac problems, you think maybe the classic left-sided chest pain, but it could be more generalized chest pain. It could be some sort of weakness or fatigue as well. So again, being able to sort of dial back a little bit and say, okay, this isn't fitting a classic pattern. Could it be something else? That's what the authors of this study really focused on as well. There is some advice, which is that you should be as clear as you can when you're going to see your doctor, your nurse, about what's been going on. Make sure you're a good historian. That can really also offer up clues that could help make it more likely you'd get the right diagnosis. And also be sure to ask these questions. What could be causing my problem? But then also the follow-up. What else could it be? Gets everyone thinking into other possibilities of what might be going on there. And if there's test results, when will those test results come back, Christina? You want to figure that out. And what decision will then get made based on those test results? Doesn't solve for these gigantic numbers, but it can certainly make a difference in terms of actually getting to the right diagnosis or not missing the diagnosis in the first place. Christina?